Good evening. Do we need to go to the doctors when we get sick? In many cases, could a nurse practitioner, highly qualified nurse, deal with us quite safely and adequately? When we get sick, of course, we go to the doctor. This we think. This we do. We get sick, we go to the doctor. But nurses are saying up to 70% of illnesses can be dealt with just fine by a nurse. Nurse practitioners, highly trained nurses with specialist skills who are qualified to assess and to diagnose and, if necessary, prescribe treatments, including drugs. The Medical Association, of course, the Doctors Association, the Doctors Union, is a bit nervous. The idea of nurses or nurse practitioners working on their own diagnosing and prescribing makes them jumpy. But nurse practitioners have worked successfully for decades overseas, and they're about to be officially recognised for the first time here in New Zealand. But there is tension. This from John Selwood.
Louisa's patch in South Westland is vast. Making patient calls can mean travelling hundreds of kilometres, often into rugged terrain.
So you've been keeping well since I last caught up with you?
Yeah, our legs are buggered, that's all.
Stan lives in the back of Beyond. The nearest hospital is more than 3 hours away, the closest doctor around an hour and a half's drive.
She's the best little nurse I've ever met. And that's not bullshit. Bloody would have died if it hadn't been for her.
You just put your hand on that one for me?
For Stan and many others in this isolated region, Louisa is first call for medical care and emergencies.
Fox 913 to ambulance control, how do you receive, over?
When there's a serious accident in Fox, it's Louisa's ambulance pager which is activated. Her advanced training crucial when lives are at risk. When it comes to medical emergencies, Louisa is the front line around these parts, but that doesn't mean she's always able to respond as effectively as she might like. And that's because when it comes to treatment, at times her hands are tied. Unlike a doctor, she is not able to prescribe drugs.
There have been times when I have needed to have the authority to give medication, and I simply haven't had the means of communication. I'm first on call for the ambulance. They have responded me to make those judgment calls to assess how critical or serious the incident is, how many people are involved, and yet my hands are tied because legislatively I'm not covered to give medication without first seeking approval, being given that authority from a GP or one of the house surgeons.
The same applies when Louisa is treating more routine, run-of-the-mill ailments at her daily clinic in the rural township of Fox.
To me, that looks like it's a fungal infection. Yeah. If you've been doing a bit of walking and if your footwear have been a bit wet, then sometimes that will happen. Yeah. The best thing for it is to get a cream, which I'll just have to give Peter a ring about.
Louisa is confident of her assessment and diagnosis and even has a treatment on hand to prescribe. But she can't, not without first calling a doctor for approval.
Hi Peter, how are you? Listen, I've got Ted with me, Ted O'Keefe. Yeah. He's got an infection, it's between his middle toes on the right foot. Yeah. To me it appears like it's a tinea, and I'm just wondering if I can go ahead and use some cream to improve that for him.
On the other end of the line is Dr. Peter Connolly, who works in collaboration with Louisa and 3 other rural nurses.
They have to rely on me to prescribe the treatment, whereas almost always they know what to do anyway.
With the full backing of Peter and her colleagues, Louisa will apply within the next few months to become one of this country's first nurse practitioners. Only the most highly trained nurses in the country will be certified. Minimum qualifications, a master's degree and at least 5 years specialist training in a chosen field. But if Louisa does make the grade, becomes a nurse practitioner, the rules change. She'll be able to diagnose and prescribe treatments herself. Louisa will no longer have to call Peter for approval when dealing with medical issues within her area of expertise. Do you have any doubt that the nurses in your area, people like Louisa, are capable of taking that step up to diagnosis and prescribe?
Absolutely not. I know their capabilities. I know they're able to do it.
Louisa will still work closely with Peter as part of the team, but she'll be able to make decisions independently when she feels circumstances are appropriate. But that word independent makes the Medical Association very, very nervous.
We don't think that there is a range of medications that is necessarily safe for autonomous and independent prescribing. We would like to see the further development of collaborative arrangements where nurses and doctors worked as part of a team.
No, isn't it a fantastic day?
Patients we spoke to didn't see a problem with Louisa prescribing. If she was uncertain, they were confident she'd pass them on to someone who was more experienced, the same way a GP refers patients to a specialist.
Yes, I would be perfectly happy for her to prescribe necessary treatment.
Because we know that if Louisa can't help us with what's wrong, then she's just going to refer to the doctor. So I don't think that's an issue at all.
We are very concerned to protect the health of New Zealanders, and we think that there are sufficient safety issues that are more complex than they might appear on the surface.
If it was the case that I felt uncertain, in other words, if this situation appeared to be outside of the guidelines that I've established and the assessment that I've made, then of course I wouldn't take any chances. I wouldn't risk it for myself professionally or for the patient. I would get on the phone and I would use that.
And that's the point, say nurses. Independent prescribing doesn't mean that nurse practitioners will be working in isolation. Louisa says it's not about replacing the doctor, more working alongside.
Which would be very nice and harmonious, and the doctors say their opposition to nurse practitioners got nothing to do with protecting their patches or their loss of patients and the potential loss of income, they say. They say it's safety, patient safety is what they're concerned about.